In this Bondi Vet compilation, we celebrate our courageous furry friends with fewer limbs.
I'm absolutely sure you're going to find her to be incredible.
From an extraordinary dog with only 2 legs,
They've never seen a dog do what Faith does.
to a tailless cat with a shocking story,
I've never seen anything like this in my whole career.
and even a 3-legged cow not to be messed with.
She's strong.
She is.
These inspirational animals prove that anything is possible.
With you, with me, with us, we won't let him down.
A very good afternoon, ladies and gentlemen. This is a general check-in call for those guests travelling on board Virgin Australia Flight VA1 service to Los Angeles.
I've been doing a lot of travel lately, but the trip I'm about to take to the States is pretty special to me.
Attention all passengers.
Hey, how are you?
Hi, welcome to Virgin Australia. How are you?
Very well. Off to the US today.
Okay.
I'm off to see an extraordinary celebrity now. I'm not sure if you'd call her a 2-legged or a 4-legged one, but either way, I'm absolutely sure you're going to find her to be incredible.
So that's yours, and this is your ticket all inside.
Brilliant.
Enjoy your flight.
Will do. Thank you. See you later.
ya.
After 14 hours in the air to LA, Chris has now caught a connecting flight to Indianapolis in America's Midwest, the home of his favourite celebrity.
7 years ago, I had the privilege of meeting Faith the very first time, and I've got to say, her bravery, it left a lasting impression on me. I'm back this time for a very special celebration. It was one I was never going to miss.
Hi.
Hello.
How are you?
Hey, it's so good to see you.
It's great to see you.
How are you going?
I'm doing fine, thank you. You look great.
Well, likewise.
You know you haven't changed. It's not
Supporting a different
fair.
team now.
Live in Indiana.
Well, that's it. Where is she?
She's inside. Come
All
on.
right. Hello, beautiful girl. Look at you. She's still amazing.
Thank you.
I walk in the door and my reaction is exactly the same as it was the first time. Absolute disbelief over what I'm seeing.
Where's my present?
She said, did you bring me anything?
Huh?
No, did you bring
Is that
me?
what you were asking? Present will come later.
For her, it's like seeing an old friend. She's like, oh, look, it's Dr. Chris.
The funny thing is, I feel as excited now about meeting Faith the second time as I did for the first. Mainly because ever since I met her, I really haven't stopped thinking about her.
You see squirrels?
When Chris first met Jude Stringfellow and her famous 2-legged canine, it was in their former home of Oklahoma in 2006, and Faith was only 3 years old.
She's gone squirrel hunting. We'll see you in a while.
As this truly amazing bipedal canine chased squirrels, Chris discovered how Jude saved Faith's life.
When Jude first met her, Faith had 2 deformed front legs. She was told by everyone to put her down. She was told that she'd have no quality of life.
I knew that she was going to die if I didn't help her. It was definitely life or death, and I had to be there for her. I said, you know what, we're going to do this. This dog's going to have to walk. If she's going to make it, she's going to have to do it on her own.
Jude tried lots of ways to convince Faith's body to do the impossible and walk. Nothing seemed to work until she tried a spoonful of peanut butter.
Or would stick it above her nose and raise it up and watch her actually get interested in it and then kind of pull her away, and that way she could follow the spoon.
Since that time, Faith has become a worldwide phenomenon and inspired millions of people with her courage.
There's no doubt that Faith is a big celebrity over here. She's done all the talk shows. Oprah called her her favourite ever guest. And she's racked up some serious miles on those little 2 legs of hers. She's been overseas on missions for the army. She's helped out war victims. It's amazing what she's managed to achieve in her life.
A few months ago, Jude contacted Chris to invite him to 2 major milestones in Faith's life: her 10th birthday party and her official farewell from public life.
I can't believe she's almost 10 and she's retiring.
She is. It's time. It's time. Choosing now to allow her to retire is the best decision that I can make for her, as she's my friend. And I can see her leaving in grace and leaving at the top of her game.
I remember seeing her 7 years ago and how well she got around. Thank you. But, hang on. It's still amazing for me to see, honestly.
She's doing really well. That is still one of the things that truly astounds me. You know, everything I've ever been taught, everything I've ever seen says to me that's not possible.
Exactly, and I like that.
There's still this incredible sense of disbelief of what I'm saying. Walking on two legs is essentially anatomically impossible. It asks her hips, her back, and her legs to do something they were never designed to do. If I know Faith like I think I know Faith, the one true test of how she's going and how she's approaching her retirement is going to be in the park.
You haven't seen her chase a squirrel. She's still got it.
She's still giving him hell?
Yeah. They're a little safer.
Really?
Not so much.
Can we go and have a look?
Sure.
Is that all right?
Yeah, we have time. Do you want to go to the park?
Squirrels? Yeah.
I'm really keen to see how she's going now. It's been 7 years since I saw her.
She's different, isn't she?
She is, but she's still the same Faith.
I mean, we get older, but she shows it more.
Yeah. And she has these little rests, does she? Every
She
now and
does.
then. Hey.
She's waiting for you to pick her up again. That's
Of course. That's good, girl. That's good.
Come on, puppy.
Yeah, she's a little bit greyer and skin's just hanging a little bit looser
Yeah.
than it was. Hey, girl. Come on, girl. Come on. Hey. I heard a squirrel was up here. Right? What she does is still remarkable. It's just done in shorter bursts. Come on, let's go. Squirrel over here. Honestly, I'm sure I saw it. Come on. Come on, girl. Come on.
One of the reasons that we are retiring her now is I want her to be able to leave in grace rather than to be seen as a dilapidated dog. I want her to be happy and jovial and healthy.
Hey, come here. Come here, girl. Come on.
Faith may not be as active as she used to be, but people are still amazed by her extraordinary efforts.
What do you think?
It's pretty amazing.
It's pretty amazing.
Amazing. Do you want to touch
Hi.
her? Say hi.
She likes you. She likes little girls.
Oh, a little hug.
Oh, sweet.
You ever seen a dog like that before?
Yeah, two, look. Arms.
Two.
He has two arms too.
Yeah, on two.
I never seen a dog like that. That's pretty amazing. Walking upright on two legs. I'm amazed.
Squirrel. Get it. Get that squirrel. Get that squirrel. Go, get it.
All of a sudden, she springs to life, doesn't she? Come on. We've got no resting now, is there, huh?
He's waiting on you.
Up here. Come on.
See him? Get it. Go.
It's great to see that Faith still has that sudden burst of energy to enable her to chase a squirrel. When she sees them and when she smells them, all of a sudden, Faith, she's not 10 anymore. She's 2. And away she goes.
Get it. Go, get it.
Up here. Come on.
See him?
Retirement is so close, but right until the end, this superstar is on a tight schedule.
Hey, over here.
Tomorrow, Faith will make her last community visit as the VIP guest at a local school.
I'm sorry, girl. I think that one got away. Yeah? All right. Come on. Let's grab you now. Let's go. Come on. Time to go home. There'll be another one. Faithy, you look ready. This is the last community service she does.
This is it.
Amazing. Come on, girl. Let's do it.
Can you make his legs longer?
Today, the two-legged marvel is about to make her final community appearance before she retires.
I think this is a great one because she gets to see children.
How many legs does your dog at home have? 4. And how does the dog walk?
Like this. This. Like that.
That's how your dogs walk, isn't it?
My dog. Hi, guys.
Hello, guys. Have you guys ever seen a dog that can do this?
Wow!
That is pretty cool, huh?
Yes. What happened to her arms?
She was born this way. Can you see?
You can pet her.
Yeah,
you can pet her.
They are absolutely dumbstruck by what they're seeing in front of them. They've never seen a dog do what Faith does. It's pretty special, huh? You ever seen a dog like this before?
No.
Over her 10-year career, Faith has appeared on national television and been a draw card at huge public events.
Look at her, isn't she cool?
Now she may be older, greyer and slower, but her power to inspire is still exactly the same.
There's a spot.
She worked really hard at her dreams, and she made it happen because she really, really believed that she could. So is there something in your heart that you believe you can do? Maybe play football, because you look like a football player.
Thumbnail.
Yeah, see?
For the past 10 years, Faith's life has been all about this sort of work, visiting schools, visiting military personnel, helping out people in need. Yet, that's now all over. But the brighter side of that is that now she can enjoy her retirement on her own terms.
Thank you guys for listening to me. You want to pet on Faith?
Say thank you for sharing Faith with us.
Can we play with her? Sure.
I would say emotionally, I have mixed feelings inside me. On one side, I'm kind of glad that it's all over and we can say she can relax now and be a regular dog. And then there's that other part of me that says, oh, we have so much more to do. We could have seen so many more people. So it's very emotional for me.
Bye.
Bye, Faith. I love you, Faith.
When you realise all the amazing work that Faith's done, I think the least we can do is honour that, and the best way to do that is with a party.
In Indianapolis, Faith's surprise party is underway. They're just waiting for the guest of honour.
It means a lot to me to do this for Faith. We've had her for 10 years. I'm inspired by my own dog, and she's amazing. She's my baby, and I'm thrilled and blessed to have her.
Hey, Jude.
Yes?
You better come in here.
Thank you, guys. Oh my God, Nancy. Hello. Thank God. Thank you.
It just warms my heart to know that Faith is going to go out with a lot of friends and family. It could have been a bigger deal. We could have made a huge thing out of it, but I'm so glad they didn't. I'm glad they just wanted it to be close.
It's green for your army green.
Have a look at your cake, girl.
Ooh, be careful there. Be careful.
It's funny to think I've come 15,000 kilometres for a party, but this isn't any ordinary party because this isn't any ordinary dog. It's Faith. She deserves everything she gets tonight, and most importantly, she deserves a really, really happy retirement. Should we cut the cake? Do we eat?
Ready? Oh, good puppy.
You know what? This is what retirement looks like. Retirement's pretty good, huh?
This is it. You know, it's over, and I don't know how I'm going to feel, tomorrow morning or next week, but right now it feels pretty good, pretty warm inside.
Seeing Faith and having that experience again of watching her walk, watching in disbelief at what she manages to achieve, has made this journey worthwhile.
So this is a stray kitten that a lady's been looking after, but unfortunately she couldn't come in today because she's got COVID. Her friends dropped the cat off, doesn't know anything about the kitten. Hello, yes. Just to say you've got an injury on your back end somewhere, haven't you?
A kitten has arrived at Scott's Isleworth practice with no name and virtually no details of what's wrong with him.
All right, shall we have a look at you? Hey?
Scott's in for a shock
Look how pretty you are.
when he discovers the nature of the little stray's injury.
Oh my God. Oh my God.
Oh my God.
Its tail's been ripped off. Isn't that just shocking?
Yeah.
My heart's absolutely broken for this poor little kitten. The injury that this kitten has suffered is absolutely horrific. I haven't got any information as yet, and I'm wondering, has it maybe had an incident with a car, it's run, and the tail's been run over, and the cat's kept going? This was an agonizing, almost tearing of the tail away from this poor cat's body. You can see that we have probably a good couple of centimetres of exposed spinal column. So we're going to have to clean this up.
While his hapless patient is prepped for surgery,
Make some calls to clients sometimes, but not usually to say their animal's lost a body part and they didn't know.
Scott calls the lady who rescued the tiny stray to see if she can shed some light on his horrendous injuries.
Oh, hi there, Alice. It's Scott Miller here, the vet from the Vet in Old Isleworth.
Hi.
You've got COVID at the moment, haven't you? You all right?
Yeah, I'm fine. Absolutely.
You poor thing. Just tell me a little bit more about this little stray kitten. Your friend mentioned that the cat had a bit of a sore at the back end. What did you understand that his injuries were?
He got caught underneath his recliner sofa.
Oh, a recliner sofa. Oh, I get it. So when it reclined, his tail was in the gap.
Probably what it is.
Oh, Alice. Gosh. Oh, you poor things. It sounds horrific.
It was a terrible day.
All right then, Alice. All the best. Okay.
Thanks.
Bye. Bye. Oh my God. I feel so much for this family. They were trying to do the right thing. They'd rescued a cat, and yet less than 24 hours into that journey, this cat's had its tail ripped from its body. That process of amputation was not a quick one. This is just a traumatizing situation for all involved. Still so sweet, aren't you? You're always such a nice boy. Tail or no tail, you're an absolute sweetheart. Yeah.
Given what the young stray has endured, Scott gives him a name that reflects his unfortunate start to life.
So many animals are called lucky. I think unlucky, eh? Unlucky. Whenever we see a patient that suffered a traumatic tail injury, we always want to check for two things. First of all, that there's something called anal tone, that the bum kind of puckers when you touch it, and that will show that they're not going to be incontinent. And the second thing is that they can still use their back legs and they're nice and strong on them, because sometimes when you pull the tail, it can affect the spinal cord further up the body, and that can have an impact on the hind limbs function. So that's good. Shows that he's not going to be constipated alongside having this awful injury.
Finally, some good news for Unlucky. His hind legs and rear end seem to be working normally.
Okay, buddy. Sleepy time now. Good boy. Have a lovely dream and try and forget that nightmare you've been through. So what I'm going to be doing with Unlucky here is I'm just clipping up the tail and seeing what's left. Oh my God. Wow. This section at the end is actually a vertebrae. So that's actually a bit of bone. The spine is made up of a series of vertebrae, as we know, and then the ones in the tail stacked along. This one hasn't pulled off completely, but is folded to the side. It's absolutely horrific. I've never seen anything like this in my whole career. I've seen some pretty severe injuries, but one as a result of a reclining chair, well, this is a first for me. So what I need to do is to trim that back and to be able to cover the skin in the area. So yeah, it's a shame that Unlucky won't have a tail, but he's managed to survive this horrific ordeal. He's lost 2/3 of his tail. Unfortunately, he's going to lose a little bit more now. And accidents happen. And I can relate to that because my cat Ricketts has actually had this procedure done 3 times. When he was very young, he got it stuck in a door, had to take a little bit off. Then got it stuck in a window, take a little bit more off. And then he got attacked by another cat, had to take a little bit more off. So pretty much every few years, Ricketts' tail got ever increasingly shorter. So Little Unlucky won't miss his tail because he has lost it at a very early stage of his development. This guy will develop perfectly well without it, so he'll be just fine. That's all done. That looks a lot better, so I can say with complete modesty that I am far better at amputating a cat's tail than a recliner chair. After 24 years, thank goodness for that. I just finished his back end. I just come to the front because I wanted to check his mouth, because my thought would be If my tail was caught in a reclining chair, I would probably try and bite at it, thinking it was trying to attack me. And then looking into his little mouth, you can see that he's actually lost both of his bottom baby canines, and there's actually some loose teeth here, so he's definitely given that reclining chair a good old bite. Just like when a mountain lion's got their leg caught in a snare, they'll chew at the actual trap, but also the leg themselves. And in this case, this kitten has been chewing and biting at the sofa to try and let this tail go. Yeah, good boy. That's it. Well done. There we go. Oh, good little man. He's obviously been lost or abandoned. Then he's found a new home, only to have his tail be amputated. I think the name Unlucky really suits him. I hope this is the end of his bad luck. He's not had a good run, have you, mate? You need to start looking after yourself. Good boy. Oh, poor little boy. Yes, come on then. Come on then. Sweetheart, good boy. Just leave surgery to the professionals, okay? All right. Good boy.
Anxiously waiting for news is Unlucky's rescuer, Alice.
Hi there, Alice. It's Scott here again, the vet. How are you?
Hi.
He's lost about 2/3 of the length of the tail, and we thought it was a good idea to microchip him at the same time so that hopefully this is the last time that he's ever stray again. He has been incredibly unlucky. Giving him that as a nickname, actually. I hope you don't mind. But he's young, and I think that he'll get over it very, very quickly. So I really don't think that you should worry. He's lost a magnificent tail, but he's gained some lovely owners and a lovely new home. So Unlucky will be just fine.
Okay.
Okay. See you later. Speak soon. Unlucky's owner said what a beautiful, fluffy tail that this little kitten had. And yes, he's been quite unlucky, but he got away with this traumatic injury. So I'd hope that even though he has a short tail, he will have a very long and healthy future ahead of him.
When she gets a good bit of momentum, she's got heaps of rotation and thoracolumbar spine as well.
That hip will start to wear properly. I worry about her knee and her ankle though.
In Sydney, Audrey is catching up with good friend Matt, who wants her advice about his beloved Rottweiler, Sunday.
Her only saving grace is that she does so much swimming that she's well muscled. Alrighty, good girl. A lady messaged us on Instagram and said, I've got a dog that's missing a leg. So she shows up with this beautiful Rottweiler puppy, and I looked at it and I just thought, this dog's going to change my life. Yeah, you can kind of see she's got less muscle on that left leg with a little nubby.
Yeah.
Sunday was born with 4 legs, but on the second day of her life, she needed to have her back left foot cut off, just below her ankle. I don't know the story why. I think a few of the puppies in the litter didn't make it. She was lucky that that's all that happened to her.
How's she going?
Yeah, she's going pretty good. Starting to show a little bit of lameness and limping, and you can tell she's getting a bit sore on it.
Sunday's so important to Matt, and you can see their amazing relationship and bond.
Do you want to party again?
We're a little bit worried because she's starting to struggle just walking on 3 legs.
Come on, sweetie.
In the past, we've managed her with external prosthesis, but that's obviously uncomfortable for her, and she's not really liking having that attached to her leg.
Today, Sunday is walking without her prosthetic foot, so Audrey can gauge how the 3-year-old copes with her disability.
You can see that she's sort of curving around in an unusual way and just kind of bending that right leg to compensate.
Yeah, she's a beautiful dog and I love her, and I just want to see her have a really good quality of life, so I'd love to see what you think and what can be done.
So it'd be interesting to kind of see her in the rehab clinic.
Come on, hey!
After observing Sunday outdoors, Audrey is now keen to get a more scientific analysis of how she walks.
Come on, in this room. What I do at the animal rehab clinic, the way you should think about it, it's kind of like a physio clinic for animals. So anything that a human might go to a chiro or a physio or a massage therapist for, that's the kind of stuff that we do. Up you get.
Good girl.
Good. Stay.
Good girl, son. Stay.
You wait.
Stay.
Matt is a trained chiropractor, but swapped treating humans to co-found one of the world's few rehab facilities exclusively for animals.
Good girl. Good girl. Matt has had Sunday since she was only a puppy and seen her grow, and he's been amazing with her rehab. Clever girl.
Audrey will put Sunday through an extensive testing program before advising Matt on whether Sunday's damaged leg can be saved.
Good girl, good girl.
I've done every single thing that is possibly available, and even a little bit experimental, to give her the best chance at having a good quality of life. She's my kid, and I want to do everything I can.
I think we both kind of know we leave it any longer, she's going to start coming into problems.
Good girl, Pachacha. Good girl.
Good girl. We'll give you treaties afterwards, okay?
After a stint on the treadmill without a walking aid,
Alrighty, up.
All right, up.
Sunday now has a prosthetic foot attached, so Audrey can analyse any differences in her gait.
She's using it, which is good. That right back leg actually looks very good. It's nice and straight, and she's really extending that knee, and then she's losing that curve in her back as well. So it looks almost like she's walking normally on her good leg.
Computer data of Sunday's paws hitting the treadmill confirm Audrey's observations.
So you can see actually 4 footprints on that pressure plate. You can see that that right back leg can actually stretch to a normal position and almost walk like a normal leg, which is what we were worried about. I'd love to see her in the water bath.
Okay, well, are you ready for a swim?
Next, Audrey will test Sunday to see how well her legs work in water.
See, she's actually kicking that back leg as if it was a full leg.
Yeah, she does swimming 3 or 4 times a week.
And that's probably what's just keeping her muscle mass. Look at you, darling. You enjoy your swims? Sunday is a nice young dog. She's really, really healthy with all the exercise she's been getting. What's also encouraging to see is that her spine's actually sitting straight. So that tells me that if she is allowed to use all 4 legs at the same length, she actually walks normally. You're lucky your dad has a rehab clinic, aren't you?
Yeah, that's right. Up you get.
All right, and just having a feel of that stump. She's never had a foot, but she kind of knows how to use that leg.
Yeah.
And that's quite surprising.
But you can see as well, her ankle doesn't straighten as much as what you'd like it to, just because it spends so much time in the bent position.
Finally, Audrey is ready to advise Matt on the best path forward for his much-loved companion.
Good girl, Pachacha.
How are you feeling about surgical options at this stage for her to try and help her walk a bit more normally?
Yeah, it's scary.
Something needs to be done. We've tried those external prosthetics. Osseointegration surgery is a new type of surgery. It's been done plenty of times in humans, but not much on animals. So instead of using an external prosthesis, which provides a lot of discomfort, using something internally where we screw it into the bone should hopefully provide her more comfort, get her using that leg properly again.
There's no easy road out of this. It's we do nothing and she progressively degenerates with the hip and the knee, or we do something and hopefully it goes well, and it might not. So it's scary.
Yeah. Surgery like this is really tricky for any owner, especially Matt, because he has such a strong bond with Sunday. I really feel for him, because if this was my child or my dog, it kind of tears at the heartstrings. You don't know what the right decision is.
I've kind of resolved to the thought that to give her the best chance at a good quality of life for however many years she's with me, I kind of have to go through with this.
Yeah.
Three-legged dog Sunday has arrived at SASH for a crucial CT scan that could pave the way for life-changing surgery.
You want to sit up on the couch, don't you?
Owner Matt has agreed to revolutionary technology where a permanent prosthesis would be inserted into the 3-year-old's amputated leg.
G'day, Matt.
Hey, Dan. How you doing?
Hello, Sunday. Come on in.
Alrighty.
But first, orthopaedic surgeon Dan has to decide if Sunday is a suitable candidate for the new and risky procedure.
It's interesting watching her walking around in here, isn't it? She really wants to use that limb.
It's like she's constantly got this, trying to touch the floor. I'd say she's trying to kickstart a motorbike.
CT is going to be our best way of knowing where we can potentially put an implant in. Sunday does still have her ankle joint there. It would seem really nice to be able to keep that. The CT will probably give us the information we need for that. Okay, let's get her admitted.
All right.
Osseointegration's a rarely performed procedure. It's been done in small numbers of veterinary patients around the world, but hasn't yet been mastered. Sunday's a patient who we really think can benefit tremendously from this process, but I can't say to Matt, with my hand on my heart, she has a chance of this doing well.
The worst case scenario of this is she has an examination and some imaging, and she could possibly not be a good candidate, which means that we'll just have to kind of figure out what to do to give her a good quality of life without giving her a prosthetic. How's this? You okay?
Okay, let's go on through.
An anxious Matt is about to find out if his beloved Sunday can undergo the potentially life-changing surgery.
There seems to be quite a lot of good bone stock here in her tibia that we should be able to take advantage of. Looks quite nice and straight here, flared at the bottom to stop the implant from moving, and all the things we'd really hope to see here and allow us to move forward with giving Sunday a new foot. Pretty promising.
Super.
Next time we're going to see each other and see Sunday is when we're going ahead with the surgery.
All right, beautiful. Well, thank you very much. Appreciate it.
See you later.
My feelings about the surgery are mixed. I'm on one hand pretty scared that it's a little bit cutting edge and we don't know exactly what the outcome's going to be, but I'm excited now that we can keep moving forwards with it, and it's the best opportunity she's got.
Matt's anxiety is sure to intensify. Today's successful scan means the risky surgery can now go ahead.
Come on, Pachacho. Good girl.
Okay, Matt, I thought it'd be really nice for you to come and meet the experts from the human orthopaedic world who are adapting their technology for Sunday.
Yep.
And show how we're going to make these implants fit into a dog's leg.
Wonderful.
Preparations are now well underway for Rottweiler Sunday's groundbreaking surgery on her amputated leg.
Hi guys.
Dan, how are you?
Matt.
Matt, nice to meet you. Nice to meet you. Sorry.
And Mustafa.
How are you?
Owner Matt and orthopaedic surgeon Dan are meeting the team behind the state-of-the-art technology they hope will transform Sunday's life.
It's amazing stuff, seeing the mixture of the technology with the surgery too.
Osseointegration surgery means bonding of metal implant with the bone.
That's the bit that is hanging out of the bottom of the leg.
That's the piece that's hanging out the bottom of the leg?
Yep.
It's revolutionary technology that involves inserting a high tensile strength titanium implant into the residual bone of an amputee.
I guess the further we go through the process, the more refined that design can become.
Absolutely.
The team has created a 3D computer model of Sunday's leg, enabling them to design the exact implant she'll need to walk on all four legs.
This is the implant that is going to go into Sunday, or a similar implant.
Yep. Absolutely mind-bending. How much technology and genius goes into this, and all I've got to do is stand aside and say yes and cross my fingers.
As easy as doing that, and comes off.
That is amazing.
Orthopaedic surgeons Mustafa and Munjid usually perform this exciting surgical technique on humans.
Yeah, this is a prototype basically, this is not the real thing.
Sunday is one of the first cases in the world where the innovative technology has been adapted to animals.
Operating on humans is second nature. Working on a dog, it's definitely cutting-edge surgery. From a design point of view, there are anatomical differences. There are issues that we may not anticipate.
Matt, that's our plan. Let's see if we can execute it for Sunday.
Yep, looking forward to it.
Hopefully it will work.
I certainly care, and I'm certainly worried, and I know there's risk with it, but I want her to have a good quality of life, and this opportunity I think can get that. Thank you very much.
Okay, thank you very much.
See you guys.
While he trusts the new technology, Matt is anxious for his precious companion.
Pop. There's lots of unknowns. I really worry that it might break, it might wreck the bone, it might injure her. You gonna give Matt a smile?
After a massive build-up,
you're gonna be a goodie.
Matt and his beloved Sunday are ready for breakthrough surgery that will give the 3-year-old a brand new leg.
You don't want to get out to your pachacho. This is not a negotiation today, I'm sorry. To me, today was an inevitability, and I am terrified that something will go badly. But I almost feel bound by fate that there's been so many things fall into place. I sort of think this is meant to be. Come on.
COVID restrictions mean an anxious Matt can't be with his adored Rottweiler for the high-risk operation.
Give me a kiss. Good girl.
After a goodbye kiss, Matt hands Sunday over to orthopaedic surgeon Dan.
Sunday, who's that?
Hello, sweetheart. You good girl. G'day, Matt.
Dan, how you doing?
So we've reached the day.
Yes.
How's she doing? Is she all ready to go?
Oh, she's more ready than me.
A lot of anticipation for the big day today, getting the team assembled, all the right people here to really give her the best chance of a good outcome. So plenty of nerves after so much of a build-up.
Oh, I'm going to miss you, big girl. Hey, kiss.
Oh,
that'll do it. All right,
good girl.
Off you go with Dan.
Okay.
Make sure you bring her back in one piece.
Speak soon.
Thank you.
Okay, come on, Sunday.
I don't think there's an easy way to put someone you care about so much into a risky situation, but there's no going back now.
Once inside, Sunday is sedated and prepped for the historic surgery.
Sunday couldn't possibly know what's ahead of her. Hopefully she's delighted with the outcome and everyone else is too.
Very good. Excellent.
If all goes well, Sunday will be one of the few animals in the world to have a metal implant inserted into an amputated leg.
You happy if we proceed?
Yeah, let's go.
Okay, let's get going.
Dan leads the team, which includes Dr. Munjid, a world expert in human osseointegration surgery.
Gently and delicately. Okay.
It's a delicate and painstaking procedure that works on humans, but is rarely done on animals.
So we need to bore the canal of the tibia to the size that can fit the implant. There is no room for haste here because the bone that we take out can clog and create much more friction, and that can break the tibia. If we shatter the tibia, then there is no chance for inserting the implant. And if that happens, the whole process will fail and Sunday will be worse off than what we started. I cannot hide that I'm anxious. Working on an animal is very different to the human, where the bone is much bigger and we know how much torsional force the human being can tolerate. However, none of us have the experience with how much Sunday's bone will tolerate. What I will do now, I'll check the position of the borer inside the tibia.
Munjid and his team have finished drilling into Sunday's leg without fracturing the bone.
Table up a bit, yeah, go for it, Alex.
An X-ray will show if the hole they've made is the right fit for Sunday's implant.
This looks very well. The reamer is in a good position. We have some thinning of the bone on one side, but it's in a perfect position. Okay, we reached the final stage.
If something dramatic's going to happen, it's going to happen right now, and we're all a bit nervous about that.
So we need to go gentle and slow in order to insert the implant without fracturing the tibia.
This is the critical step. We've got to the point where we've made the hole in the right spot, but now we're trying to fit an implant. We know that there's not a lot of extra bone left in her tibia after we've dug this big hole. It's a time that we're all going to have a little bit of finger crossing going on.
As the surgical team again worries they could shatter Sunday's leg, her devoted owner Matt is anxious his beloved Rottweiler will come through the risky procedure.
It's a high stakes, high emotion thing for me. I hope she's going to be okay. I'm concerned, but I'm happy that she's in good hands.
I think we can call it off now. Excellent. You can see the relief in the...
Beautiful, well done.
Let's have a look at the X-ray now.
Munjid, Dan and the team are overjoyed. Sunday's implant has been attached safely to her tibia.
You can see that's sitting very snug. Looks good. Looks very good.
Minutes later, the high-risk, high-tech surgery is over.
Great job.
Thank you so much.
Great job. Excellent. Thank you very much.
We have the implant coming out through the skin at the bottom, really nicely, firmly attached. We're really positive about what we've been able to achieve here.
This can open an era of using this kind of technology for animals that have lost limbs. So it's very exciting.
Matt, g'day.
Hey Dan, how you doing?
Oh, it's good news. All the surgery's gone ahead without any concerns. The implant's exactly where we wanted on the post-operative x-rays. It all looks really, really positive, mate.
Awesome. Good to know.
It'll take several days before Sunday is out of hospital, and then months of rehab to help her get used to her shiny new leg.
Not being able to be with her because of all the COVID stuff, it's probably equal parts difficult for both of us. I'd love to be there to make sure she's okay. We'd find a lot of comfort being there for each other. So it's going to be difficult for both of us, I think.
Good girl, Sunday. Good girl. Been through a lot, haven't you? You've done very well. Good girl.
Nice and slow. Good girl.
It's 3 months since Sunday received her brand new surgically implanted leg.
Come on, sweetie.
Owner Matt is thrilled with the progress his much-loved 3-year-old is making.
Look at you go, you're so clever. Sunday's really liking her new prosthetic foot. When she's got it on, she loves it. She walks happily, she runs, she jumps, she plays. She's just very comfortable with it.
Audrey recommended the groundbreaking surgery and can't wait to see how her star patient is going.
Hi, Matt.
Audrey.
How are you?
Very good. How are you?
Good. How's my Sunday? Look at your
Yeah, she's doing pretty good.
Look at you. You look so happy.
It really couldn't have gone any better. She's really comfortable with moving the joint. She lost her leg when she was only 2 days old, and Matt was so great to take her on and go through all the hurdles that was going to come with her. And to make a decision like this and to have a good outcome, it's going to change everybody's life.
Have a good time.
Slap me on the face.
Today I'm making the drive up to North London to see a wonderful charity called All Dogs Matter. They do really amazing work here in London where they rescue and rehome abandoned dogs. It's run by Ira and her team, and today they've asked me to come and visit a really beautiful Labrador who's got some really big problems.
Good boy. Good boy. He's a good boy. I was expecting this really poorly, 3-legged dog to come in, and the van pulled up outside and we could hear the biggest woof ever, followed by the back door opening and Marcus jumping out. We instantly fell in love with Marcus. He's adorable.
From the outset, Ira also noticed that the abandoned Marcus had a large lump growing on his leg.
We thought that maybe the reason his back leg was missing was he'd had a tumour before, a cancerous lump, and it was removed. So we thought possibly the new lump could also be cancerous. So our thought was, look, this guy is going to be put to sleep if we don't take him in. Let's at least give him a chance. Let's get the lump tested.
Hello, ladies. How are you? Hello, mates. You must be Marcus. Oh, you're a handsome chap. Oh, thank you. Big smooch. And he seems like in pretty good nick. If anything, he seems like he's been overwintering quite well. Marcus has been to the school of hard knocks. He has not got a home anymore. He's lost a leg. And now we see this lump on his leg. I mean, how much bad luck can one dog have? You want to be very brave? I'll stick a needle in your arm. Right, so this is a microscope slide box full of, guess what? Microscope slides. Yeah. What we're going to do is we're going to pop a little needle into that nasty lump. We're going to take some cells. We're going to pop it on a slide. We're going to send it to some smart people at a lab, and they're going to tell us if we should be worried. How's that sound? Are you worried? No.
We'll be waiting with bated breath, hoping that that comes back as benign. And as soon as we get that result, we'll sort of start looking for Marcus's forever home. That's our hope. He's such a special boy, and we're just hoping and praying for him that it'll be good. An extra kiss for luck.
Yes. Yeah, you deserve it. Boy.
Slowly, baby. Come on. You're a good boy.
In Richmond, 3-legged rescue dog Marcus is heading in to see Scott.
Should we go, baby? Come on, slowly.
Hello, Nina.
Oh, yeah.
How great to see you.
Yeah, me too.
Hello, Marcus.
Hi,
Gina, look at this guy. What a handsome fellow, isn't he?
Hello.
Hi,
Say hi to Gina.
Oh, lovely kitty.
Yeah.
Carer Nina has been helping to look after the Labrador since he was saved by a dog rescue charity.
Cuddles are over, mate. Me and Nina need to have a chat, so let's go into the consult room, shall we? Come on then, big guy.
Even though Marcus is very happy, loves his walk, loves being around us, there are a few signs that are a little bit worrying. He drinks a lot of water, he gets tired very quickly. I'm ready for the best, but I'm also a little bit ready for the worst.
I'm a little caught out by the result that we've got. We found some cells called spindle cells.
Right.
And spindle cells are the starting blocks of a type of tumour. And the worst case scenario is it can be an incredibly nasty tumour called fibrosarcoma, which can spread to all areas of this dog.
Do you think he has spread already, or will the cell just be in the tumour?
At this stage, I don't know.
And do we have a way to find out?
We do, absolutely we do. What we need to do is determine if the tumour has spread, where it's spread, and what type of tumour it might be. In this instance, the worst case scenario for a normal dog, you'd remove the leg. We don't have that option with him.
We don't. We can't do that, obviously.
I know and I can feel already how much of an impact this dog's made on you. So I know
He's
that.
wonderful, Scott. I don't understand. How can people give up on such a loving dog? I don't understand. Today is a very difficult day. I wanted to burst into tears, but I didn't want to show this emotion to Marcus because being so happy in front of me and not knowing what's happening, and I don't think it was fair on him, so I did hold on to my emotion and try to keep the happy face.
Scott will now take x-rays of Marcus to find out if the cancer has spread.
We don't know what's going to happen. Scott will soon come back with a verdict. No matter what, we will never give up. You need to be full of hope and you need to try. And this is where I think his kindness has paid off, because finally, with you, with me, with us, we won't let him down, no matter what.
You're damn right we won't. Look at this guy.
Oh, hello.
This handsome fellow is Marcus.
Hi, Marcus.
Hey,
Oh my
honestly.
God, look at him. I know you said you were bringing me a new man that I might fall in love with, but
There you go.
yeah.
Isn't he gorgeous? Thankfully, he's incredibly oblivious. Aren't you? You just love all the love and attention.
Oh,
you don't care.
look.
You don't care. Yeah. Yeah, and just all the rest of us feeling very melancholy.
Oh, you're such a sook. Look at you. Hmm?
What we need to do is do various x-rays in order to determine if the tumour has spread, where it's spread, and what type of tumour it might be. Whatever God or not you pray to, let's just pray that this dog is going to be okay.
Really need the lights off.
That's it.
There we go.
X-ray.
With Marcus's foster carer Nina waiting nervously upstairs, Scott and Emma are about to look at the chest x-rays.
Is this just normal?
Yeah, there's no tumours we need to worry about there. It's all looking pretty healthy. Okay, good. Let's move on to abdominal x-rays then.
It's good news so far, with the chest clear of tumours, but they also need to check the spleen, the area that Scott is most worried about.
Generally, this type of tumour will spread to the spleen. But so far, so good. That looks like a nice, beautiful, healthy spleen of a beautiful dog. So that's good. So I'll go and give Nina that good news, and then you can get set up for taking the lump off.
Will do.
There isn't any presence of cancerous lumps, so that's really great news, and it does mean that at least at this stage, the cancer hasn't spread. So no tumours I can see, all right? So nothing in the chest, nothing in the abdomen. What I need to do now is to actually move forward to surgery.
Okay.
And I'm going to be taking the lump off.
Brilliant. Oh, I'm so happy. Oh, I'm so happy. It's brilliant. Very good news. Thank you so much, Scott. Thank you. Good luck.
Thank you.
All the best.
But while Nina is feeling more positive, Scott is well aware Marcus is not out of danger yet.
This is a rocky road and I don't know where it's going to go, and I only will know once I actually remove the mass. Sizable, I'll give it that. It's quite a sizable mass, this. It's very, very vascular, which means there's a huge amount of blood supply to it. And generally, cancers can be quite greedy. They like lots and lots of blood to grow and do their evil pursuits.
Because of Marcus's excessive bleeding, Emma is using an electrocauterizer. The superheated tip of the probe seals the tissues and blood vessels, helping to stop the bleeding.
This tumour is a horrific, ugly, nasty-looking thing. It's the definition of what you would expect cancer looks like. This thing is stuck firmly to the skin on this side. So to remove it completely is going to prove very difficult. I know I'm not going to be able to remove the whole thing. It's impossible. I'd have to take his leg off, and that we know is impossible. So I'm just going to take as much as I can, hit it as hard as I can, and hope for the best. Get out. This tumour is a horrific, ugly, nasty-looking thing. It's horrible and it's invasive. It's going deep into Marcus's leg. Normally, in potential cancerous lumps, you have to remove around 3 centimetres in all directions. Well, if I take 3 centimetres in all directions, he loses his leg. But he can't lose his leg because he's already lost one. So I'm just in a very, very difficult situation where all I can do is try and remove as much of the tumour as I possibly can, and then just hope like hell that the result comes back that it's one of the less nasty ones. Really a bit of a half-assed job, and that is not my happy place. Okay, here we go. Yeah, it's pretty grim, isn't it?
That's absolutely foul.
That's disgusting.
This does not look nice, so I am concerned about Marcus's future, but I need to hold fire on my concern. I need to be there for Nina through the process. We'll send it off to the lab, and fingers crossed.
If Marcus is lucky and the tumour turns out to be a low-grade cancer, the Labrador has a good chance of survival.
I mean, I still have hope that we'll get a result which means that he will live a number of happy years, but we just need to be patient and be prepared for the worst as well. So it's going to be a tough wait.
Yeah. Today is a very difficult day, but I have to hold on tight about the fact that no matter what, we will do our best to give him that quality of life. Will it be a month, 6 months, a year, 2 years? I have no idea. But during that time, for sure, he will be cared for and never, ever found himself abandoned again. You've got a nice bed waiting for you. And I know someone who's going to sleep next to you tonight, and that's going to be me. Just to make sure you're okay. Yeah. Do you like your new friend? Yeah, is that nice? Is that fun? Oh, little sweetheart, we need your bandage off. Then you'll be fine. Ah, no.
It's been 3 days since Scott removed a nasty lump from the 3-legged Labrador.
Sit.
The results have just come back, and tests have revealed that the tumour is a low-grade sarcoma cancer. But while it's malignant, it's not aggressive.
There is a big chance that it might regrow in the same area. And if we have to remove the tumour again, then we will do. But the chances of it actually spreading to other parts of his body are really low. And so that's really good news for the future of Marcus.
Wow, what a nice ball you've got. Django, come on bring your ball. Slowly, slowly.
And that's not the only good news for Marcus. He's going to stay with Nina and her family for the immediate future.
Obviously, we hope for the best and we will see what happens, but for the moment, for sure, he's really happy and he's fine. You are doing very, very well. You're getting better by the day.
Gretel's a dear little bobby calf we rescued a couple of years ago. She was born with 3 legs. She's coping really well with her disability.
I've never seen a 3-legged cow before.
At Edgar's mission, Chris's next patient is Gretel.
Having 3 legs actually saved her life. She touched the farmer's heart, who was so struck by this little calf and her ability to get around on 3 legs and cope that they wanted to find a good outcome for her.
How you going?
Hi Chris,
How
nice to meet you.
Hey,
I'm Kyle.
Hey Kyle. I can see what she likes.
Yeah.
But this is the problem, isn't it?
That's right, yeah, the hoof's starting to compensate there and growing awkwardly.
The problem with her situation is that it's pushing those toes outwards, and those toes are actually becoming malformed. They now need trimming, otherwise they'll keep on growing to the point where she just won't be able to walk. Normally with cows like this that weigh 600-700 kilos, they're in charge. They're the boss here. But here, the odds are a little bit more in our favour.
Yeah.
Provided we can keep some weight on her with Kyle, I think we're a good chance actually just trimming that foot without any drugs, without any yards,
Oh, that's good.
without any pain.
That sounds like a plan.
Normally cows only give you 1 chance. If you blow that, you've totally lost your cover and they'll just run away. We've got to make the most of this chance. If I can just get my fingers into her nose, it's really good control for them. They shouldn't really move their head after that.
I'm going to be a bit nervous while Chris is actually doing this procedure on Gretel because it is very tricky.
Just going to get my fingers into her nose. Hey. Yep. Didn't really get the fingers in the nose. It's a bit more of a wrestler than I thought.
Yeah.
She's strong.
She is.
Yeah, she's had to be, you know, and she's tough. She doesn't like to feel like things aren't going away because she knows that she's a little bit vulnerable.
Yeah.
Hey, come on. It's all right. Let's get a hand in here. Come on. Let's put push her head down. Yep. It's all hands on deck, call in whoever we can, and make sure we get this hoof trimmed right now. I just don't think they're going to be able to get underneath this toe here. So I'm going to have to use the angle grinder.
Yep.
Normally angle grinders are used to cut steel. Today, they're being used for something entirely different.
Yeah. Whoa, good girl, good girl. Good girl, well done. Good girl. Good girl. Well done.
Gretzky, I think we're done, girl.
Good girl. Oh,
We're done.
good girl.
Yeah, I'm happy.
Good girl. Oh.
We're done.
Good girl, well done. What did they do to you, hey? What did they do to you? What did that naughty Dr. Chris do, Gretel? Oh.
After everything Gretel and I have been through in the last few minutes, the only way I'm going to feel okay is if we kiss and make up. It's better for you than it is for me, trust me. Oh. I probably had one coming, didn't I?
It's actually better than what I thought, the outcome. We've trimmed both of those front hoofs and it's come up really well.
You got other plans, I can see. You're a girl in a hurry. Don't mind me, all right? He's obviously waiting for you. Before I even have a chance to say goodbye, Gretel's gone. Why is she gone? She wants to show off the new shoes to a boyfriend, Hansel.
Hi, I'm Dr. Kate, and if you enjoyed this video, make sure you subscribe to the Bondi Vet YouTube channel. Click on the screen for more great content. And for free, exclusive, never seen before Bondi Vet stories, you can sign up to bondipet.com, and you can do so via the link in the description.